everybody. Welcome to the Glow Podcast. I'm here today with a very exciting guest. I have Roland on, and I'm super excited to talk to him. He is from Honest Taskers, but if you are new here, we are Tailored Marketing, and we partner with organizations in the health, wellness, and longevity space to fuel growth through strategic marketing and sales strategies. So if you are interested, drop a comment below. Roland, thank you so much for coming on. I'm super excited to talk to you. If you would, I would love if you would just go ahead and give a little bit of an introduction so the listeners know who you are.
Yeah, thank you so much for having me on your podcast. Really appreciate it. My name is Roland. We're based in Fort Worth, Texas. We work in the medical space. We support healthcare practices and also dental practices with remote workers who are based in Latin America and also some from the Philippines. To basically reduce their admin costs and basically keep the overheads low.
That's awesome. Yeah, no, that's super, super cool. And I feel like I've worked with medical practices before, and I know that that is definitely something that they need, because when you go to, get your doctor degree, like when you become a physician, you learn how to become a physician, but a lot of times you don't learn those back end things. And so it's like they really, really need help with a lot of that stuff. And that's super, super cool. And so what primarily admin tasks do you guys focus on, or is it kind of everything?
Yeah, I mean, we kind of have specialty, but the way I like to phrase it is that if you have basically any admin task that could be done without a license, right, then we could provide somebody that could support your practice. So, for example, we staff practices with virtual medical receptionists, virtual medical assistants, virtual medical biller, virtual coders, patient care coordinator, referral coordinator, intake nurse, triage nurse. We do a variety of things within the medical space. And sometimes we even provide custom solutions based on the need of that particular practice. So, we're basically everywhere. Sometimes, practice owners are really shocked with the level of talent that we're able to present them with, because they kind of struggle to hire locally.
Yeah.
Usually for most practices, their first intent is to hire locally. They want to hire local talent, but most of the times the talent is not there for them to hire from. Or maybe they hire people and the turnover rate is extremely high and they're constantly training new people. It's very frustrating for a business owner to always go through that.
For sure. Well, and then that's another advantage too of working with you all, I guess, would be that they don't necessarily have to train them. They're already trained. They can just kind of pass over the materials to you, and then they already know how to do this because they've done it before as well.
That's right. One of the things that you quickly discover about our program is that we only staff experienced candidates. So let's say you're looking for example, I just staffed a practice in Arizona. It's a huge practice, and they needed a cardiovascular coder, right? And we're able to staff them with somebody with 5 years of experience doing medical coding, kind of specializing in cardiology. And such a talent, locally will cost them maybe around almost $40 per hour for somebody with that level of experience and expertise. But they were able to hire that talent from us for about $16 per hour. Huge difference, but also the person is very talented, right?
Yeah.
But again, every organization have different workflows. So the training that you mostly give them is based on your internal workflows and processes, but not how to do the job itself.
Yeah, they already know how to do the job itself, but they might need to learn how to use a new system or whatever.
That's right.
Yeah,
That's right.
Exactly. No, that totally makes sense. Well, and then also for your employees and the virtual assistants who are in other places as well, that $16 an hour to them is probably more than the $40 in the USA.
I'll share a story with you. For example, today I had an interview with a pain medicine doctor, and he's looking to hire a scribe. In that interview, we had 3 candidates. 2 of them were medical doctors, and 1 of them was a nurse. And it's because in their country, they make more working remotely as a virtual healthcare assistant compared to working locally. So sometimes the doctors in America are really shocked with the quality of talent that they are going to get with the amount of money that they're spending, but now realizing that, in those countries, the cost of living is low and it's really good compensation. And that's why, last month our retention rate, last month, the attrition rate was around 2.5%. This month is 2%, very low. So we tend to keep talent for a very long time because it's good compensation also, and we provide them with healthcare. You'd be surprised how much it costs for us to provide healthcare for our VAs who are based in the Philippines. Amazing.
Yeah, no, I believe it. That's super, super cool because you get to provide the doctors with amazing talent, like you said, where they're like, if they were hiring in the US, maybe they would just be getting someone who studied biology in college or whatever, and they're just out of college and they would need to do extensive training. But with these potential doctors or nurses based somewhere else, they already have so much training and like know all of the vocabulary, know all of the language. And so it's a really, really cool model. And I feel like it works really well, honestly, for everybody, which doesn't always happen in business.
Sure, sure. I mean, right now we're getting a lot of requests. Like, I think it's a very new space for a lot of doctors. Some of them are just surprised that something like this is possible. One of the biggest concerns that people have is security and HIPAA, right? To make sure that they're in compliance, and that's something that we also take very serious. That's something that we can go like a little bit deeper on next.
Yeah, no, yeah, I would love to hear kind of more about that a little bit, just because obviously compliance with any medical office is going to be a huge thing. And I mean, we are more familiar with it now, after, especially that's one of the things I think that came from COVID
That's
is
right.
more of this telemedicine model and working with people in a way where maybe they're not right next to you. But with compliance being such a big thing with medical practices, how do you all kind of conquer that obstacle?
Yeah, so number one, we are based in Texas. So every practice that we work with, we sign a BAA agreement. So the practice is doing business, number one, with a Texas-based company. And
Okay.
we carry different levels of insurance liability protection in case of any data breaches. I mean, like that has never happened, but like we always have those protections. Then number two, they're all HIPAA compliant, so they take our HIPAA certification course and they go through that process like once every 3 months. So I mean, like most clinics don't do it that frequent, but we do it every 3 months. Or like they go through our HIPAA training. And also for our VAs who are based in the Philippines, they actually have like a law which is similar to the HIPAA. That's why the industry grew so much in the Philippines.
Okay.
Some of the biggest multinationals, like United, Blue Cross Blue Shield, I mean, like all of these huge insurance companies, like they all have like offices in the Philippines that is supporting their operations here based in the US. So we're basically giving mid-sized and small businesses the opportunity to kind of lower their admin costs, just like the big boys are doing.
Yeah. No, it's super, super cool. Such an interesting business model. And how did you kind of come up with this idea? Because I do feel like it is, like you were saying, it's kind of a newer idea. Sometimes when you're going and talking to these practitioners, they're like, like I haven't heard of this before. Like it sounds like such a good idea, but it is newer. So how did you come up with it?
So actually, like I had no idea this even existed because for the past 15 years, I ran a tutoring platform. It's called Frog Tutoring. It's kind of
Okay.
in staffing. We had thousands of tutors across the US and we matched them with students who are looking for tutors. So I like to put it, like we're like Uber for tutors, right? So let's say you live in Seattle and you need a tutor for chemistry for your son. We could get one of our local tutors to come to the house and work with your kid or support them remote. So I used to have some staff who are based in the Philippines to support the back end recruiting of tutors. Then my wife is also a psychiatry nurse practitioner and she owns her own practice. So she started the practice during the pandemic and she was basically struggling with staffing. And I basically helped her staff her practice with, one of our remote workers that was based in the Philippines. And, like it was so successful that her friends who also own practices, they were reaching out to her, hey, I need somebody like the person who supports your practice to help us out. So for me, that's where the journey is. I said, okay, let me go ahead and start something so we can help your friends who also own practices.
That's
That way they have
awesome.
people to come. Because sometimes, like you have, like especially like the newcomers, like single practice owners, it's really tough for them to kind of have a medical biller, have a medical scribe, have a medical receptionist. It's just very costly for them to even get started, like with that level of expense. So they usually start with us. I mean, today I spoke to two solo providers. So these are doctors who are just working by themselves and they need somebody to support them administratively, all right? From answering the phone to doing prescription refills, patient communication, prior authorization, insurance verification, referral coordinator, basically all the things that it takes to make a
Yeah.
medical clinic work. I mean, you'll be amazed that I spoke to a doctor, I think she's a I forgot her specialty. I think she's a neurologist. And
Uh-huh.
she told me, Roland, I see two patients a day, but it takes like 10 hours just
I
because of
believe
all the
it. Yeah.
work that it takes. Because for her to see the patient, she first of all needs to contact the insurance and get authorization and get insurance verification for every medication. She needs to get, it's a lot of process that is involved. And
Yeah.
sometimes it's just extremely time consuming for you as a doctor to spend that amount of time doing those basic stuff that somebody could do it for you for like $10.65 per hour. I mean, it's a no-brainer, for most doctors and most practices.
Yeah, no, for sure. Well, and the best businesses I feel like are invented like out of necessity. And it sounds like your wife was like patient zero. She was like the complete vision for it of like, okay, if she needs this, then and her friends, I know other doctors need this. Like
That's right.
especially like you were saying too with like those solo practitioners where like it's just them. And like
Hmm.
as a patient, you don't see all of the behind the scenes that has to be done, but there is so much that has to be done. Like my boyfriend's a nurse as well too, and like he
Yeah,
tells me, the charting and stuff is sometimes half of the job.
that's right. That's right. That's right. Exactly. I mean, I'm telling you, there are some doctors that will gain about 3 hours a day, once they hire a medical scribe, right, to just basically shadow them throughout the day and do the documentation. And the doctor could simply focus on patient experience and patient care, right? Like we even have some practices where they have like iPads, like in the exam rooms. So once the patient gets to the clinic, the MA at the office simply have to take their weight, check their vitals. And once the patient is waiting in the exam room to be seen by the doctor, then we have a virtual nurse that's going to pop up on the iPad. Hi, this is,
Yeah.
Vivian with blah, blah, blah clinic, and basically do the entire intake. So once the doctor comes, they already have all the notes from that intake and they could simply consult the patients and get them out of the office quickly. So it's very, very, very efficient.
Yeah, no, that's super, super cool. That's awesome. And so, is that kind of the biggest thing that you see when, say, a doctor does hire somebody on your team that like they see a huge time return investment, or is there anything else that you've seen from any of your existing clients that they say, like, I'm so happy we hired y'all for this specific reason?
Yeah, so like it just depends what they hired us for, right?
Yeah.
So I'll give you a good example. Like we have a medical practice, it's a dermatology practice based in Florida. I think they have about maybe 10 locations, and they used to
Okay.
outsource their medical billing to another company, but it's very costly for them to outsource their billing because the company takes a percentage of everything they're billing. So they're looking to basically create an in-house medical billing team. So what they did was they hired one on-site billing manager, and they came to us and they hired a bunch of medical billers to support the on-site person. I'm telling you, it reduced their cost, like their billing cost, by over 70% compared to what they
Wow.
used to pay the billing company. So they have a huge saving in real money, not just time, real money, right? Because it's billing,
Yeah.
right? But when we deal with some doctors that need scribing, in that case, the doctor save because sometimes they go back home and they're still doing documentation. So like they don't really have time to spend with their kids or with their family because like they have to make sure that like the charts are ready for them to get paid. Because as a doctor, once you don't chart, it's hard to get reimbursed, right?
Yeah.
So in a way, you end up spending after hours that you're supposed to be with your family, but now you're basically busy doing charting.
Yeah.
Like in those cases, they save time. I think like an average of 2 to 3 hours a day, but also they get reimbursed quicker because their notes are ready at the end of every day, right? Then for clinics who hire us for front end support, like front office, they basically provide better patient experience because I'm not sure if you've realized it. If you call a medical practice, they mostly miss their calls. A lot
Yeah.
of practices
You're right.
if you call your doctor office, whenever they pick up the phone, you're extremely surprised. Oh, wow, somebody picked up,
Yeah.
right?
No,
I
that
think
is very
study,
true.
yeah, I think study says that they missed about 35% of phone calls that go to us. Like that, most medical practices missed about 35% of their phone calls. And some of those phone calls are new patients, turning patients, basically they're missing money. And they're also basically like their existing patients are not really happy with the experience, right? Calling and not getting anybody to answer your phone.
Yeah. No, that totally makes sense. And yeah, I feel like y'all have so many different offerings too that it's almost like certain clinics and certain offices could probably use you for a lot of their staffing as well
Yeah,
too,
yeah.
which is cool.
And for me, One of my focus lately is, especially like holistic medical practices and aesthetic, which is cash pay heavy,
Yeah.
right? And most of them, like the job is not just task oriented, but it also involves some sales,
Yeah.
right? Right. So like one of the things we're seeing now is that we're staffing some practices, especially like in the cash pay space, with not just virtual medical assistant, but sales-oriented virtual medical assistant. Somebody that could take your existing, for example, we have a physical therapy, which is mostly cash pay practice, and
Yeah.
they have about 10,000 patients in their database. But the thing is, the practice is mostly reactionary, right? Like they always wait for their patients to call, but they have patients that they could call and get them on their appointment list. For example, let's say somebody was there 6 months ago and they complained of back pain, they came and they did some treatment. Nobody's following up with them to see, like what is their current state after 6 months or after a year. And if they
Yeah.
complain of some pain, that's a perfect opportunity to get them back to the clinic, right?
For
Yeah,
sure.
but most clinics are not doing that because they don't have the manpower to do it. So that's why sometimes we go into these practices and we support them with a sales-oriented virtual medical assistant that's just simply going to target your database of existing patients and just call them and check on them and see what it is that they need at this time. Based on the question that they ask, they might have a need to come back to the clinic.
Yeah, no, that totally makes sense. And that's such a good idea too, because yeah, a lot of those cash-based practices, like you were saying, physical therapy, aesthetics, chiropractic, even, like they don't necessarily always schedule you, and like you said, it's very reactionary, so you kind of
Mm-hmm.
forget about it sometimes. Like if you
Mm-hmm.
haven't been to your med spa in say like 6 months, like you might, med spa is probably not one you'll forget about, honestly, because you'll be like, oh, I need my Botox or I need my filler. That wasn't a good example, but physical therapy, I do feel like if you're not having any issues, like say you were having knee pain before and then it went away, but like there's maybe that little sliver of it,
That's right. That's
then
right.
it's like taking somebody to reach out to you and be like, hey, like we can fit you in here, whatever,
Yeah.
exactly. So yeah,
Yeah.
no, that totally makes sense. And
Yeah.
so over the next year or two, kind of what are your goals with Honest Taskers, and what are you guys kind of focused on?
Right now, this year, we're seeing about like a 300% growth. So we're
Wow.
just simply focused on that niche.
Yeah.
We're trying to serve more doctors, we're trying to serve more dentists, we're trying to serve as many people as possible and just keep growing our team. So that's the only industry we operate in, like in the healthcare space. We're trying to go much deeper in that space. Right. And right now we have some corporate clients that we work with.
Do you work with specific doctors, or is it really any type of doctors?
Basically, any type of medical practice.
Yeah.
So like that could be cardiologists, primary care, mental health, surgery centers, psychotherapy,
Yeah.
like medical aesthetic, dentistry, basically anything in the healthcare space, like
Okay.
telemedicine. Yeah,
Yeah. And it's all primarily right now in the United States as well,
that's
correct?
right. That's right. Like we only support medical practices in the US. And sometimes, they require, for example, a lot of our partners who are based in California, Texas, and Florida, they mostly preferred bilingual front desk
Yeah.
receptionists. So usually we staff those from candidates based in Latin America.
Yeah, that is another huge pro too to it that I honestly didn't even think of, because in the US you can find bilingual sometimes, but it's not as common. But most people, I'm sure, that you're staffing in Latin America, they're 100% going to speak English and
That's right. That's
Spanish.
right. And sometimes in the US, when you find a bilingual talent, they might not be, I mean, like the education level might not be what you want also,
Yeah.
right? So as we staffed a medical, it's a primary care practice. It's based in Florida. They hired two scribes from us. One of the scribe is based in Brazil, so she speaks English and Portuguese, and she's a nurse in Brazil. Then another one is a general physician based in Nicaragua, right? And she's also working as a scribe, and she's bilingual. It's kind of hard for you to match that talent.
Yeah, no, it definitely is, because yeah, no, I mean, I completely agree with you. That's like another huge pro. Like I was saying, that honestly at first I didn't even really think about, because in the US it is harder to find people who are bilingual, and like you said, also at that education level as well.
Mm-hmm. Mm-hmm.
Well, tell everybody what is the best place to find you and the best place to find Honest Taskers. I will also include all of the links in the show notes as well for easy access.
So the best place to get in touch with us is our website. That's honesttaskers.com. Just go to our website and schedule discovery meeting on the website. Just click on the button and within 2 seconds you book a meeting with us.
Awesome. Thank you so much for coming on and talking more about Honest Taskers and everything that you all are doing over there and all the awesome things. I really, really appreciate you and your time.
Thank you so much for having me here, Taylor. I really appreciate it.